All right. Thank you so much for joining us today. We are here with Purdue University, and we're going to talk a little bit about stackable credentials, advancing your healthcare career. And this is going to be related to the Master of Health Administration program and their corresponding graduate certificates. So let's go ahead and get started today. Okay, so for our agenda, we'll have a little bit of introduction about our team and then Purdue University, and then we'll jump right into probably why you're here today. We're going to have some program information with Dr. Mullen, and then I will come back, talk a little bit about the student experience, kind of what you can expect, and then we'll do a brief admissions overview. And then at the very end, we'll have some time for Q&A. So, as we move through today's presentation, if you have any questions at any point along the way, feel free to use the Q&A that's there in Zoom. Drop your questions in there. If they're questions that we can answer kind of like at that point in the webinar, we'll be happy to do that for you. Otherwise, we'll kind of hold them till the end and we'll kind of wrap up with all of those. And then just as a reminder, this session will be recorded so that way, once we're done, we can send it out to you in a recording. So if for some reason you have to leave early, that's okay. I mean, obviously, we want you to stay the whole time if you can, but if you can't, we'll again send that recording out to you once it is over. So we'll go on, just meet our team. So I am Shantelle Estes. I am the online program enrollment counselor. I work specifically with the Master of Health Administration program, as well as our Master of Public Health. And then I have a couple of other programs that I support as well. And then Dr. Mullen is with us today, and I'll let him introduce himself here in just a few minutes. But he is the clinical professor and director of professional graduate education in the Department of Public Health here at Purdue University. Now, let's talk a little bit about okay, Purdue. So for those of you who may not know, Purdue University's main campus is located in West Lafayette, Indiana, right here in the heart of the Midwest. Purdue has been consistently ranked among the top public universities in the country. We were known as a tier one research institution, a top 10 public university, and a top 10 most innovative university. And then most recently, we've been ranked eighth in best colleges for veterans. And we are also a proud yellow ribbon school. Now, to date, our online students from all of our online programs here at Purdue, they represent 128 countries from around the world, which really makes for an incredibly diverse and collaborative learning community in all of our programs. Now, this is one thing that I think is really cool, but Purdue has been at the forefront of like digital learning, offering, those rigorous, high quality online programs long before remote education ever really became kind of the global norm that it is today. And as you're looking at like, okay, hey, I want to enroll in Purdue University's online graduate programs, know that these online graduate degrees and those certificate programs that go along with it, that you are truly being taught, by faculty that many of them may be teaching on that West Lafayette flagship campus. And so knowing that our online programs, that they're going to hold the same rigor and the same types of accreditation as you might expect from a Purdue main campus program. So you're still getting that same high quality, affordable education that's designed for working professionals. And we'll talk a little bit more about that at the end, kind of what that working professional, school relationship kind of looks like. But really, it's going to be flexible enough to fit your life and advance your career at the same time. And then once you've completed one of our online graduate programs, you're going to become a Purdue graduate and you are going to join a vibrant and supportive network of over 600,000 living Boilermakers spanning pretty much every continent and all industries. So, really, no matter where you go, you're probably going to find a fellow Boilermaker. So that's a little bit about, kind of our team here and Purdue University. But let's move on to probably why you really came today. And I'm going to turn it over to Dr. Mullen. I'll let him introduce himself, and then he's going to share more about what we call the stackable credentials that we offer inside of that Master of Health Administration program, then how you can use those to advance your healthcare career. And then I'll be back. We'll share more about that online experience and the admissions process. So let me quit sharing my screen, and then Dr. Mullen, I'll let you take it away.
Wonderful. Well, good afternoon or good morning wherever you may be. Let me get everything all set up on my side. Q&A. So I do have the Q&A in chat. So as Chantelle mentioned, if you have a question that comes up during the conversation, please feel free to put those into either the chat or the Q&A. No, I'll probably acknowledge that I saw it, or you'll see me pause and I do a quick skim of it. And if we can answer it, great. Or I'll make a comment, hey, that's a great question, and we'll answer that coming up of where we're at. So pleasure to be with you today to talk about our MHA degree program, which involves you stackable credentials as well. So as Chantel mentioned, I'm sorry, my puppy just woke up from her nap. So if you hear the little toe taps, I apologize. She was supposed to sleep till 5, but got up an hour early. My name is Cody Mullen. I'm a clinical professor, as Chantel mentioned, in the Department of Public Health on our flagship campus here in Purdue, West Lafayette. Our Boilermakers made it to the Elite Eight this year in basketball, so that was really exciting. A little sad that we are not playing in the Final Four, which is only an hour south of Indianapolis. I've been at Purdue for 5 years as faculty, and when I was hired in, my job was to launch the MHA degree and run the MHA degree. So it's exciting to see where our degree has gone. I also serve as the Director of Professional Graduate Studies within our department, so I also have oversight of our MPH degrees, both residentially and online. So if you're like, I'm not really sure which degree I want to get or how to do that, that is okay. Please meet with either Chantel or I. We both support those degrees. And towards the end, we'll kind of talk about who to talk to for different activities as well. I came from industry. I spent about 15 years in the industry while I did my PhD and after the PhD, primarily in the rural health and disability health space. And I try to bring a lot of that experience into the classroom as well as many of our instructors who do as well. So I kind of want to start with the headline slide of stackable credentials. I'm then going to do a quick industry update of what we see in the industry and how these stackable credentials are addressing these issues. And then at the end, we'll wrap back around about the full MHA degree and then finish again with the certificates. But if you're like, okay, I'm in industry, Cody, I'm working out there, but I don't have an MHA, I don't have a graduate degree, and that's holding me back from getting promoted or growing in my position. Or I have a degree, but it wasn't in healthcare. I don't want to do yet another master's degree, but there's some skill sets I really need to learn to be successful in my career. And that is where what we call these post-baccalaureate graduate certificates come into play. You can think of these like a minor, but you're not required to get a major when you earn them. You can also get them, and we'll talk at the end. If you're doing the full MHA, you can also earn each of these as you go throughout. But we have three unique certificate opportunities. You can do one, two, or you can do all three. If you do all three, I'd encourage you to do the full MHA as well. And we'll talk about that at the end because at that point, you've pretty much done the whole degree minus a semester and a half. But we have a leadership certificate, we have an operations certificate, and we have a quality improvement certificate. And each of these certificates are 9 credit hours. They're 3 courses. Each course meets 7 to 8 weeks in length, depending on the semester that they're taught. So really in a semester and a half, or if you double up in one of those 8 week periods of time, in one semester, you can earn this credential and graduate immediately with it. And we'll talk at the end about what goes into each of these, but I want you to think through of leadership, of operations, and of quality improvement. And as we talk through our industry update, kind of relate back to what those look like as you think about those different areas as well. So, as an industry, I don't know who's on this call. I know we have a lot of people. Some of you may be sitting in a hospital. Some of you may be sitting in a clinic. Some of you may be as fortunate as I am and have a work from home day and trying to keep the kids or the animals quiet while you're working. But whatever or wherever you're at, I think it's important to level set where are we as an industry in the healthcare. We can't talk about healthcare without talking about money. We are nearly 20% of the economy of our nation. If we look at our growth, our national health expenditure as a percentage of gross domestic product or GDP over time, we see that we've been hovering right around that 17.6, 17.7 spot. We saw a spike during 2020 and 2021. Not surprisingly, that was the COVID, that was pandemic. Not only because we saw more healthcare expenditures occurring during that period of time, but also reduction in overall expenditures elsewhere. Because we weren't going out to eat as often or things like that. So GDP, the numerator was going up while the denominator was going down. So therefore, we saw a massive increase in the percentage. But if we notice post-pandemic in 2022 and 2023, we're kind of level where we were before the pandemic. And then in 2024, this data just came out in January of this year. So this data is about a year delayed by the time we get the calculations out. We see this somewhat significant increase to 18% in 2024. Um, Economists will tell us danger Will Robinson if our industry ever hits that 20% mark. And we're on track to do that probably by 2032 to 2033 based on this growth rate. Again, where's that increase of spending going? So using that same report that came out in Health Affairs, and we look at the main payers that we use, private health insurance, Medicare and Medicaid, as well as the uninsured, we see that growth is occurring in all of them. In 2024, all four payers saw 7% or higher growth year over year in each of them. We see significant growth in private health insurance, which if you're an employer, if you're working on the HR factors of healthcare, one of your largest expenses is health insurance. It's ensuring that your employees have access to the services that they provide every day. That's changing the way we deliver care. It's changing the way we deliver operations. At Purdue, our second largest expenditure outside of salaries is health insurance. It's a large expenditure. But we're also seeing growth in Medicare and Medicaid, and we saw a lot of attention on that under the Affordable Care, or sorry, under the Affordable Care Act under Obama, but also under the One Big Beautiful Bill or HR one, HB one, that was passed just last year by President Trump and the Republican-controlled House and Senate. We're also seeing significant growth. We saw a decline of it, but significant growth in 2024 on the uninsured. So if we're going back to the stackable credentials, you're like, okay, Cody, this is a lot of great data, but what does this mean? Well, a leadership credential is org behavior. It is strategic planning. It is teaching you how to prepare for this changing landscape. Operations, finance, and accounting and operations. How do we function in this? And then quality improvement. How do we use data to make actionable decisions to drive my organization forward? If we survey, so this data is a little bit old now. So this is a January 2026 survey. So we're talking about 4 months ago. New data, I think, just came out today from KFF, and I haven't had time to fully read it. But if we ask individuals, what are your biggest worries right now? And think back to January, we weren't necessarily having all the global activities that we're seeing currently right now in our country. Where was the number one worry? It was in healthcare. It was going to see the doctor. It was going to the prescription to fill that prescription and that dosage. Um, that is worrying people. That copay, that deductible, and all those things. Very few are not too worried or not worried at all. If you look at these other areas, food and groceries, rent and mortgage, monthly utilities, gasoline, transportation, the fear was much less there. Some less than 50%. Where healthcare was higher. Again, thinking through if I'm in an operations certificate or if I'm in a leadership certificate, how do I lead my employees, the team that I work with on a daily basis? How do I lead them forward to be able to support the and support themselves and be ready for that? If we think of healthcare, right? A lot of people, if I ask, especially when I teach in the undergraduate program here at Purdue, I ask my freshmen in the classroom, when you think of healthcare, what picture comes to your forefront of your head? And probably 8 out of 10 of them will say a hospital comes to their head. But healthcare is so much more than that. And actually, the hospital is becoming less and less of a role that it played as we're seeing great advancements in AI and outpatient surgery and other specialty care that can be done outside the walls and outside of laying in a bed for greater than 24 hours for that. So if you're thinking about, okay, I'm thinking I want to do healthcare, but I'm new to the field, I ask you, where do you see your best fit? Is that in the primary care space? Is that helping individuals and identifying them before the disease has started and maintaining that optimal health? Is that secondary level care? Is that once the disease has started, but it's not significant, and we're treating that very easily right now, right? Maybe it's early hypertension and you're on a hypertensive medicine, or maybe it's metabolic disorder and you're going on the GLP-1, which we just saw this morning that the pill form of that was just approved by Eli Lilly by the FDA. Secondary care. And again, being done in that outpatient setting. Or are you really fascinated with that really advanced, cool science care? I mean, it's amazing what our clinicians, I'm not a clinician. I joke that I'm a doctor that can't help anyone. And when I'm in a healthcare study, I never use the word doctor in front of my name. Because the next thing I want to do is say, hey, there's a code blue. Can you come help us? So I would not be the right person to do that. I could help them bill it, but that'd be about it. But if you go to tertiary care, quaternary care, really in that forefront at that precipice of pushing science. But there's other pots. There's nursing home care, there's hospice care, there's palliative care. There are all these different areas that are supporting care needs out there as well. I also get a lot of questions, especially when I'm working with our undergrad students. What can I do with this degree when I graduate? How many of you will have either parents or a spouse or kids? They're like, okay, yeah, you want to go to school, but what are you going to do about that? So, new data just came out in the Wall Street Journal. This came out back in, I believe it's March that this article is released. It might have been late February, looking at what is the role or what is the growth of employment and jobs in the labor market within the United States. And we're seeing that gray line, there's overall growth within the labor market since the start of 2025. But where's that growth occurred? We've actually seen a decline in all employment, excluding healthcare. And we see that decline all the way down there. And the sums of the negative 300 to 350,000 jobs have been eliminated. But then why do we have growth? Well, because there's been a mass enrollment, a mass expansion in healthcare. And as we see more clinicians and more individuals doing the frontline services, we're going to need new and fresh leadership behind them. We see a lot of the current leadership are nearing the end of their career. They're nearing retirement and they're ready to go on for whatever that next great adventure is. If that's another career, if that's other employment, or if that's simply going out and being able to play golf more often or traveling or being with friends. So now is a great time to be jumping into this field. If we want to support that data, right, and have multiple data points sharing the same thing, if we look at U.S. Bureau of Labor Statistics, we anticipate that our profession, health administration, is going to grow at a much faster than average rate, 23%, over the next decade, 2024 to 2034, with roughly 142,000 changes in jobs of a marketplace that has 616,000 jobs and a median pay of $118,000. We build on all that to also recognize that healthcare is massively changing. What healthcare was, and if you're like me, I like watching old healthcare shows along with new healthcare shows. I'm a big fan of The Pit right now. I think the last episode actually might be tonight. I'm a few episodes behind. In addition to The Pit, we also, if you watch old ER episodes from the early 1990s, healthcare has changed significantly. I always remember the first episode of ER, there was a patient that went in for gallbladder removal and they were in the hospital for 2 weeks. When I had my gallbladder out, I was home within 5 hours. I left for the new news and I made it home in time for the 6 o'clock news. Things are changing and we need new leaders and new thought processes and those willing and able to work with data, large and giant data, to be prepared for what that next thing. So if we think of healthcare 1.0 at the center of the sphere, the circle, we had very small data sets, we had sole providers, single clinicians, simple treatments. And as we expand further and further out into healthcare 4.0, our treatments are becoming more intelligent. We're using AI in more ways. We have networks of clinicians. We have communities within our discipline. We produce more data every day than we used to in a year. And then we also have this new idea of patient responsibility and involvement. And all of that takes fresh and new leaderships to be thinking through. And we, again, go back, think of healthcare leadership, healthcare operations, healthcare quality improvement, how all three of those fit within these things. I'm the policy professor, so I can't leave this without talking about some policy. And we've seen some seismic changes in our policies moving forward. So back on March, I think it was March 23rd to 2010, when President Obama signed the Patient Protection Affordable Care Act, also known as Obamacare or the ACA or PPACA, we saw seismic changes to healthcare being signed again on July 4th of just last year, so less than a year ago, in the One Big Beautiful Bill or HR 1, massively changing the way that our Medicaid system, our Medicare system, and healthcare as a whole is being delivered. Our program is apolitical. It's not my job to tell you this is good or bad, or these politicians are good or these politicians are bad. But it's important for us as leaders to be prepared to lead through this. Things are changing within our industry massively and quickly. And how do we prepare for those leadership changes? How do we make sure that we are current as leaders that understand what those changes are and make sure that our organization, our staff, and ultimately those that we care for are ready and prepared for that care moving forward? If we think of other current events, I was just in DC last week, a week ago on Tuesday, visiting with some of our elected officials in a personal capacity, but healthcare is still at the forefront. We are a 20% portion of the economy. We are a major, major, major piece of that. So we're constantly having those discussions. The last government shutdown that occurred in the fall was due to the expiration of the subsidies for the marketplace. Pardon me, can't get the words out. Those expired at the end of December. And we're now seeing as we enter into Q2 of this year, what's that doing to the rate of bad debt, of rate of uninsured, or rate of underinsured individuals? So it's an exciting time. It's a scary time, let's be honest, right? When we need healthcare, we need healthcare. I wake up, if I woke up and I was having a heart attack, I expect that if I call 911, an ambulance will come to my home or wherever I'm at, will get me into a facility and I'll get to the cath lab quickly if that's appropriate treatment. But we have to make sure that infrastructure is there and built. So our MHA has four key program objectives. It is identify the main components and issues of organization, financing, delivery of health services and health systems. It's to demonstrate analytical and system thinking, to identify obstacles. It's to demonstrate leadership skills by supporting individuals. And it's developing financial roadmaps by interpreting and communicating financial and accounting information, valuing programs, budgets, and so on. So I want to talk not only about the certificates, but our full MHA by showing you our whole curriculum and how the credentials match into those. I should say that our MHA has entered into CAMing candidacy status. We are in a self-study year. If you've done accreditation, either academically or in healthcare, you know what a self-study year is like. We are opening every cupboard door and finding where we can be better and documenting what we're doing on that. But remember the three certificates I've talked to you about: leadership, operations, and quality improvement. On this slide, leadership is the blue shaded courses, operations is the green shaded courses, and QI is the yellow shaded courses. So if you're like, I'm really interested in doing one certificate, this is how it matches within what would be the full curriculum. Leadership is actually the first three of the four courses you take in our program. They're entry into the profession. They're what I consider the soft skills of healthcare. How do we manage people? How do we develop strategic plans? How do we develop the business and the operations of healthcare? Our operations certificate is the business minded, the numbers and the quantitative minded side of healthcare, the financial management, the accounting, the managing of those complex organizations. And then in our yellow slide, yellow ones, our QI, our quantitative process improvement or data slides. So info powered patient care, quality and delivery, data driven decision making, and how those different pieces work together. If you're like, Cody, I want to do the full MHA, great. You can earn these certificates as you go on. So by the end of your second semester, you can graduate with a certificate while still finishing your MHA. And those stackable credentials can go on your LinkedIn, go on your resume, help you at your current employer for promotion. You're getting this, 4 or 5 semesters before you had finished the full degree. Or maybe it would help you enter the job market. Maybe you want to be an expert in operations and be able to demonstrate that quickly and do those things. You also have the opportunity, if you're like, okay, I'm going to come in and do a certificate, you really enjoy what you're learning your time here, to transfer into the full degree. You can go either direction. Start with the full degree and earn a certificate, start with the certificate or two and come on over and do the full degree, and those credits automatically count. What courses do you not get to take as a not as a certificate student? If you do the full MHA, we have an intro course, Healthcare in the United States, that level sets everything. If you're new to the industry, I would encourage you to still take that course if you're only doing a certificate. It's a great entryway into our profession and what we're doing. And then at the end, you do economics, policy, and law, that deep dive into how is the law made, how is policy made, how do the economics of all this work together. A capstone experience bringing all this together, and then our seminar experiences are really building you towards that full degree. So we come full circle again. That first slide I showed you after my introduction. If you're like, yes, I want to do a stackable certificate, these are what each of those look independently. I will highlight, I'm sure Shantelle mentioned this as well. If you're only a certificate student, federal financial aid cannot be used towards these. But if you are a full MHA student working on a certificate, financial aid can be used because you're primarily in that main degree of the master's degree. So with that, here's my information. I'll put my email in the chat towards the end of today. We will have questions and answers at the end, and I'll be here until then. But with that, I want to hand it back over to Shantelle to continue our discussion about our wonderful program.
Okay, thank you very much. Now we're going to kind of switch gears here, talk a little bit about the online experience. And before I start, I do want to say, if you've recently joined us, thank you for joining. And if you have questions for Dr. Mullen or I, feel free to drop any questions in the Q&A feature, and we'll be happy to talk about those a little bit later. So, a little bit about our online experience, and this will be true for our master's degree as well as the individual certificates, but the program is going to be 100% online. It is going to be fully asynchronous. And really, what that means is there's not going to be any set days and times for you to log in and complete the program. So if you're working, if you've got, personal, family commitments, things like that, you can still enjoy those and take care of those responsibilities while still working on your graduate degree or certificate. Now, we do utilize a 24/7 kind of online classroom, so you'll be able to access that anytime throughout the week. So if you have, kind of a weird schedule, maybe you work nights and you want to work on them during the day or vice versa, you certainly have the ability to do that. Now, as Dr. Mullen shared, we have those individual graduate certificates. Each of those are going to be 9 credit hours apiece. But for the larger Master of Health Administration program, it will be a total of 40 credit hours. It's 15 courses, and he, shared, kind of what that schedule looked like with you. But you can expect to have in the master's program 11 core classes. You'll have 3 seminar courses and then one final capstone. Now, the way that we have classes here at Purdue University, we have a semester system. So we have fall, spring, and summer. Each semester is going to be 16 weeks long. And then inside of those 16 weeks, we have a first 8 weeks and we have a second 8 weeks, or sometimes we like to call them term one and term two. But when you think about how long your classes in this program will work, most all of your classes are going to run in 8-week segments. Now, when you get to your capstone and your 3 seminar courses, those classes will run the entire 16-week semester, but everything else will be in 8 weeks. So you might take a class in the first 8 weeks, might take a class in the second 8 weeks, just kind of depends. So a lot of our students in the program are working, many of them are working full time. And so they find that being able to do one class in each of those 8 weeks is very manageable for them. So when you think about time commitments in the program, you should probably expect to spend maybe around 15 to 20 hours a week dedicated to your course for any readings, discussions, homework, projects, whatever you might have for that class. And if you did one class at a time in each of those 8 weeks, you could complete the program in 6 semesters or right at 2 years. And when we're thinking about our classes, we do tend to have smaller class sizes. So around, I'd say estimate maybe 10 to 15 per class. It just kind of varies on where students are kind of at in their plan of study. And that's really nice because it does help you develop, good relationships with your classmates as well as the faculty in those classes. Now, when you decide that you want to join our program, we're not just going to drop you into the program and say, like, hey, good luck, here's your classes. No, we actually have a really nice, robust support system that is going to help you. So, my role here as the enrollment counselor for the program is to really help you navigate through that application and admission process. Now, let's say that you apply and you are admitted and you decide, hey, I'm going to come to Purdue, I'm going to go through this MHA program or one of these graduate certificates. And then once you accept your space in the program, you're going to kind of transition from me over to the academic advisor for the program. And your academic advisor will be the one to work with you, making sure that you know what classes that you're taking, when you're going to take them, share program information, things like that. Then we also have a Veterans and Military Success Center. So for any students in the program that might have a military background, whether it's previous or current, we do have a great center there. So if you have any benefits that you believe might apply and you have questions about that, that Veterans and Military Success Center is there to help you. And then, just because you're an online student at Purdue doesn't mean that like you don't have access to other areas that you might if you were on a residential campus. So one of those areas, we do have a career center for opportunities. So, when it's coming time for, let's say, graduation, and you say, hey, I haven't updated my resume in a while, I might need a little bit of help. And, I see that the center is offering, assistance with resumes. Those are certainly things you could take advantage of if they have, you know, practice interview days or things like that. Those are always opportunities that you have the ability as a Purdue student to still take advantage of. So this next one talks a little bit about a question that I get from some of my students is like, okay, what is my diploma going to say? Is it going to say that I graduated from an online program? I'm a little concerned about that. And this is actually what your diploma will like. Obviously, it's going to have your name on it, but this is for the Master of Health Administration. And so once you graduate, it's going to say Purdue University. It's not going to say Purdue University Online Master of Health Administration. It's just going to say, Purdue and your major there. And then I don't have um, a certificate for those going through the certificate program, but you will get something very similar. It's not going to say, online program or anything like that. So if that was a concern, you don't have to worry about that. But kind of along those same lines, when we talk about graduating, you are more than welcome, and we really encourage you to, when it is time and you're finished with that Master of Health Administration program, we invite you to come to campus. You are more than welcome to come and walk in the commencement ceremonies, meet your faculty, meet some of your other classmates. It's a really nice time. You've spent, a couple years of your life. And so I encourage you to, bring your family, bring your friends. If you have children, this is a great opportunity to say, hey, this is what I've been doing for the past 2 years. Let's go and celebrate. We're done. Maybe I'll have a little bit more free time to spend with you. But I just like to share that as well, that just because you're online doesn't mean that you can't come and go through commencement with our residential students. All right, so we're going to switch gears. Again, talk a little bit about the admission requirements. In the next slide, we'll talk about the process in general. But our admission requirements, pretty simple. We're really looking for a bachelor's degree from an accredited institution. If you have a background in health administration area, that is awesome. If you don't, that's okay as well. It does not matter. So we welcome individuals from all, backgrounds as far as, majors are concerned. And so, yeah, you don't have to worry about that. Then for unconditional admission, we are looking for applicants that do have a minimum 3.0 GPA or higher. Now, we do look at applications holistically. So let's say you're like, Shantelle, my GPA is, like a 2.8, 2.9. Okay. On the next slide, we'll talk about where you can kind of address that in your application materials, just to show the admissions committee that you're acknowledging that. If you have previous experience in the healthcare industry, that's awesome. It's certainly helpful, but it is also not required. So don't feel like you have to have, I don't have 3 years of experience. That's okay. And then for this particular program, there is no additional like GMAT or GRE testing. We don't require any of that. Now, for the application process itself, so they're broken down into two steps. Step one is meet with your enrollment counselor, and that is me. Now, this is an optional step, but I do encourage you to do that. Some of you may have already met with me, and if you have, thank you. I always, just enjoy talking with any new students that are interested in the program. And if you haven't, we'll talk here in a couple of slides about ways that you can reach out to me, how we can set up times to chat. Um, but step two, and this is required if you're going to apply, you do have to complete your graduate application. So you will have one online application. And what you will do is you will, start it, you'll select the major that you are interested in. And then once you do that, it is going to populate some tabs inside of your application that are going to be very specific to the health administration or one of those graduate certificates. Now, I do want to share that the application requirements for the masters as well as the certificates, they are the exact same. So if you're thinking about, I'm not really sure, or you want to apply just to the certificate, or like Dr. Mullen said, you could do your master's and you could earn a certificate at the same time, that's okay. The materials are going to cover both of those. So what will happen is it will populate and it's going to ask you to provide your resume. So you're going to make sure that that is current, it is up to date. You're going to load that into your application. The next one, they're going to ask you for two statements. First one is an academic statement of purpose. And this is just really you sharing a little bit about your goals, why you're interested in the program, maybe how the program you think is going to help you meet those goals. If you want to share a little bit about, why you think you might be a good fit for an online program, that's a great place to put it. The second one will be a personal history statement. And this is just really your opportunity to share anything else with the admissions committee that you would like them to know about you that's not really found anyplace else in your application. So if you've had any kind of leadership experience, you've had some life experiences that have kind of led you to choosing either the master's or one of the certificates, this is a great place to share that. And then if you were one of the students that said, hey, my GPA was a little bit lower, here's when you talk about it. Now, of course, you want to be honest and just say, I acknowledge that, my GPA is not where you would like it to be. And, share why. There are very legitimate reasons why some students, just do not have as good of a GPA. Now, some students may say, I went to school a long time ago. I didn't take it very seriously, or I switched majors a lot of times because I didn't quite know what I wanted. But there are other students that maybe had personal or medical situations that kind of contributed to that lower GPA. And this is just where we want you to share that with the admissions committee. Now, both of those statements, please keep them to a maximum of 2 pages each, just nice, sweet, concise statements for the committee. And then the next thing they will ask you for are 3 letters of recommendation. Now, these do need to be academic or professional, but we're not going to tell you how many of each. So it is up to you. If you want them to all be academic, all professional, you want a mixture, that is perfectly fine. It's your choice. So we do say family and friends are not going to be considered acceptable recommenders. So think of individuals like supervisors or current employers, whether or even former employers, if you want. If maybe you just recently graduated or you're currently finishing up a bachelor's program now, and you have a faculty member that you have a good relationship with, maybe you want to talk with one of them, but it will be your choice. So what I recommend, because this part of the application it can take a little bit of time because we're relying on others to get some information for us. So I typically tell my students, once you start your application and you select your major, just drop right down into that recommendations tab. Go ahead and put their contact information in there. There'll be a couple quick questions for you to answer, and then a button that says send to recommender. Now, when you hit that button, Purdue's going to email them and let them know that you've applied to the program. Give them the steps that you need or that they need to take for you and on how to submit your letter. And then while they're working on that, you can go back, you can upload your resume, you can write your statements, you can finish filling out any of the incomplete sections. And then once you've got everything else uploaded, you can go ahead and submit your application, even if those letters of recommendation have not come in. Because what'll happen is after you submit your application, it's going to kind of go into a little holding bin, if you will. And then as those letters come in, they're going to be added to your application. Once that third letter arrives, it can automatically start moving through the review process because you've already submitted your application. So that's just kind of my little helpful tip about letters of recommendation. Now, so those are the main things that are going to be very specific to the master's degree as well as their certificates. And then all students are going to need to submit official transcripts and or academic documents. So the academic documents are typically for students that have degrees from outside of the United States, may need a diploma, something like that. And there will be a section in the application for students that have attended schools within the United States, an opportunity for you to say, I would like Purdue to try and obtain those official transcripts on my behalf. If you opt into that service, then after you've submitted your application, Purdue will reach out to those schools. If they can get those official transcripts, they're going to add them to your application. If they can't get them, then they're going to reach back out and say, hey, we couldn't get these transcripts from XYZ school. And then at that point, it would be your responsibility to have them sent. So just know that for US schools, there is an option if you would like to opt into that, that where you might be able to, try and not have to send all of your transcripts. So um, if you have any questions about transcripts, whether they're domestic transcripts or international, just please reach out to me. Every school is a little bit different, but I'll be happy to help you with that. And then the very last thing, everybody has an application fee. Domestic students, it is $60. International students, it is $75. And then for some international applicants, you may also be required to provide English proficiency test scores. And again, that will kind of vary by country. So if you have any questions about that, I'll be happy to share that information with you. But again, this will apply for the master's as well as the certificate programs. And then one final thing that I want to share before we hop to the next slide. On your application, it does give you the ability to apply to 2 programs using the same application. So if you are a student that is interested in the Master of Health Administration, and for sure one of those three certificates, you could set up your application to apply. The main program be your master's degree, and your second program be a graduate certificate. So if you are interested in that, please reach out to me and I'll put my contact information at the end. But reach out to me. I'll help make sure that you get your application set up. That way you only have to pay one application fee for that particular certificate, and we make sure that it gets through the process correctly. So that covers kind of the process for now. And then the next part, deadlines. So we do admit for both the master's and the certificates 3 times a year, fall, spring, and summer. So fall deadline is August 10th, spring deadline is December 10th, and the summer deadline is April 20th. So we are currently admitting for the rest of 2026 and all of 2027. So if you're interested in any of those, these deadlines will apply to you. Now, see, sorry, I think I went on the wrong page. Okay, perfect. So tuition rates. This will apply for the health administration as well as the graduate certificates. Sorry, I didn't put that on there. But we have in-state and out-of-state tuition. If you are an international student, you will fall under the out-of-state rate. We do not have a separate international cost, so it will be just either in-state or out-of-state. And then the program, it is 40 credit hours. So you can see, kind of that total cost there based upon your residency. And then, like Dr. Mullen said, the certificates are not eligible for federal financial aid, but the master's program is for those students that qualify. So if you have any questions about financial aid, I have put the financial aid office's email address. This will go directly to the area financial aid that supports the online graduate programs. So reach out to them with any questions that you might have. They'll be a really great resource for you there. Now, this is our last, the next one will be our last slide. So if you have any questions, just go ahead and drop them in the Q&A, and then we'll kind of, get back to that. So while we're waiting for those final questions to come through there, I just have a few things that I wanted to share with you. And I don't know why, I'm so sorry. I don't know why things keep moving. So as I've previously shared, like if we've already met, thank you so much for like reaching out. Like I always enjoy talking with my students just to see a little bit about, why they're interested in our program, how they got to this point where they think they're ready to apply. But if I've not had the opportunity to meet you, like I encourage you to reach out. You're welcome to email me. You can schedule a virtual or phone appointment with me just to go over any questions that you might have, whether it's about the program or the application process. And you can use that QR code on the screen just to access my calendar and register for a day or time that works best with your schedule. And when you sign up for a virtual appointment, it will be 20 minutes. If you select the phone option, I will call you at that day and time. And if you select Zoom, then you and I will just join Zoom at the appointed time and we will chat about any questions that you might have. And then lastly, if you're like, hey, I'm ready to apply, I've gone ahead and included the web address there that will allow you to start your application. Now, as you move through that application process, I'll be here as the enrollment counselor just to kind of guide you, and I may reach out to you from time to time. Just check on you, maybe give you updates on, kind of, hey, this is what we're still missing, especially as it gets closer to those application deadlines. But you are always welcome to reach out to me, and I will be more than happy to assist you. Now, with that being said, if you have questions that are related more to the health administration field in general, or more specific, like course related questions, you're going to want to reach out to Dr. Mullen, as he will be the best person able to assist you with those types of questions. So I'll just have him drop his email in the webinar chat, and that way you will have it. But he will be more of those health administration or even the certificate areas. Those are very, that's really his area of expertise. So I kind of allow him to do that. And then I focus more on those admission and application questions. So I do not see any questions that have come in today. Dr. Mullen, is there anything else that you wanted to share before we left?
No, there's still time for this summer. So if you're thinking, now's a great time to jump in. We'll have a wonderful cohort this summer starting. If not, there's always August, and please don't hesitate to reach out to either one of us. And if you're ever not sure who to reach out, we're happy to play connection and connect you with the right person. So just reach out to one of us and we'll connect you.
Perfect. Well, again, thank you so much for joining us. I appreciate you taking time out of your busy schedule to just learn more about our program, and I know Dr. Mullen does as well. But I do look forward to working with you, and I hope all of you have a great rest of your day.